Depression. Major depressive disorder is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Risk factors include genetics, nutritional deficiency, hormonal deficiency, electrolyte imbalance, medication, deficient in norepinephrine, serotonin, and dopamine, loss of a loved one, and an unstable job. Signs and symptoms include decreased appetite, weight loss or gain, loss of libido, lack of emotions, loss of pleasure in activities once enjoyed, agitated, and insomnia. Medications include SSRIs, NSRIs, tricyclic depressants, and MAOIs. Side effects of antidepressants include nausea, increased appetite or weight gain, loss of sexual desire and other sexual problems such as erectile dysfunction and decreased orgasm, loss of fatigue and drowsiness, insomnia, dry mouth, blurred vision, and constipation. Interventions for depression include active listening, helping the client identify negative thinking and thoughts, having a structured environment, set schedule and routine, giving plenty of time to think and respond, encouraged to participate in group therapy. Treatments include psychotherapy, family therapy, supportive psychotherapy, ECT, and antidepressants. Labs include low TSH level, low vitamin D, and anemia. Education for depression include suicide prevention therapy, compliance with medication, coping skills, educating family on signs and symptoms of one becoming depressed. Resources include a suicide prevention hotline, art therapy, and a safety plan with a list of phone numbers for family and friends. There are 3 types of depression: mild, moderate, and severe. Mild is associated with normal grieving. The way someone might present is affective, having anger and anxiety; behavioral, they're tearful and regression; cognitive, they're preoccupied with their loss; and physically, they have weight gain and have insomnia. Moderate depression is associated with dysthmic disorder when someone is sad or down in the dumps. No evidence of psychotic problems. Chronically depressed for most of the day, more days than not for at least 2 years. The presentation of moderate depression include affective, they are helpless or powerless; behavioral, they have slow movements and are slumped; cognitive, retarded thinking process and decreased concentration; physically, they have anorexia, binging, headaches, and sleep disturbances. Severe depression is symptoms of major depressive disorder and bipolar disorder. Symptoms present for at least 2 weeks and no history of manic behavior. The way someone might appear with severe depression: affective, total despair, feeling worthless; behavioral, in a curled up position, no communication; cognitive, delusional thinking, somatic delusion, confusion, and suicidal thoughts; physically, generally slowing down of the entire body and flat affect.